video, we are going to learn the importance and function of the fascial system in the body. Fascial system, also known as a connective tissue. We will also learn about a myofascial release as a therapeutic approach that helps to release the fascial restrictions.
Fascia is a three-dimensional web of tough connective tissue that spreads from head to feet without any interruption. The fascial system is a whole body system that interfaces and infuses every other system in our body. The fascia not only covers, but goes through every muscle, bone, blood vessel, nerve, organ, all the way down to the individual cells. Fascia is the great organizer of the body and organizes muscles into functional units. It also provides structure and support to all parts of our body, acting as a shock absorber and complementing our immune system. The fascial system is similar to a powerful, uninterrupted spiderweb. It has the ability to stretch and move. When people have experienced any physical or emotional trauma, inflammation, surgery, or poor posture, the fascia loses its flexibility and becomes like a straitjacket with crushing pressure and pain throughout the body. Now, we are going to use an orange to help us visualize the function and structure of healthy fascia in the body. We will see how the fascia surrounds, connects, interfaces, and infuses every muscle, nerve, bone, and every cell in our body. There are different stages of fascia, similar to an orange. Starting from the peel, it's similar to the fascia in our body under our skin. You can see how the fascia holds the skin onto the rest of the orange. Another stage divides the orange into sections, holding each part in its place. This is similar to how our organs, muscles, and bones are held in place by fascia. Lastly, observe how the container provides separation and support to the smaller parts of the orange. This is similar to how the fascia surrounds each muscle fiber and each cell in our bodies. These are images of the living human fascia, recorded from a video called Strolling Under the Skin by Dr. Jean-Claude Guimbarteau. Living fascia look like clear water-filled tubes and sealed elastic compartments. These structures allow forces that come through the body to be distributed to the whole system, preventing large forces from injuring individual parts of the body. In healthy fascia, these can freely flow past each other without restriction. In its normal state, fascia is relaxed and wavy in configuration. Trauma, inflammation, surgery, or long-term stress can make the fascial system shortened and solidified, creating fascial restrictions that can cause crushing pressure upon pain-sensitive structures, which directly affects the nerves, muscles, blood vessels, bones, and organs. This pressure can be up to 2,000 pounds per square inch. When we have restricted fascia, it behaves much like a sweater. Restrictions in one area can have an effect far away from the site of injury, affecting the entire system and making diagnosis difficult. Because the fascia and the muscles are responsible for positioning the bones in our bodies, restricted fascia will pull our bones out of proper alignment, causing dysfunctional movement patterns, bad posture, or pain.
It is important to know that myofascial restrictions do not show up in any of our medical tests that are currently utilized. Tests like X-ray, MRI, CT scans, and blood work will not show myofascial restrictions.
Myofascial restrictions can be released by applying sustained pressure and elongation into the fascial system to gain greater flexibility that can result in decreased pain, enhanced daily functional abilities, ease of movement, and improved structural balance. Myofascial release by John Barnes is a gentle approach used to help free up fascial restrictions throughout the body. This can be done through various targeted stretches and other release modalities. These myofascial stretches and releases must be held continuously from 90 to 120 seconds before the fascia even begins to let go of the tension. However, it's important to continue the stretch 3 to 5 minutes for the fascia to release and restore fluidity and ease of motion. Dr. Paul Standley, PhD, professor of physiology from the University of Arizona, discovered the benefit of sustained moderate pressure into the fascial system. He found that after 3 minutes, the tissue produced interleukins, a crystalline protein that helps activate anti-inflammatory processes in the body. If you strain fascia too hard, you can decrease the effectiveness. That's why John Barnes trained myofascial release therapists do not force the tissue but keep holding pressure until the fascia softens on its own.